And now we switch gears once again, and joining us live to discuss Texas's coronavirus preparedness, a member of the governor's strike force to reopen Texas and Texas's supply chain strike force. That's Dr. John Zerwas. Good afternoon, Dr. Zerwas.
Good afternoon.
Thanks for coming on. And now let's get right into it. Texas has gone up as far as positivity rate as a percentage over the last 7 days, and that's according to Johns Hopkins University. It's about 20%. That's a bit higher than where we were. El Paso sitting right around 11%. Now, do we know why that number has gone up, or is your data showing you something else?
Yeah, that's something that we've been watching. In fact, 20% is quite high, and it really doesn't kind of sync up to what we're seeing in some of the other numbers. Our hospitalization rates are going down. The number of new cases is going down. And so that number doesn't really quite match up. And so we're digging into some of the reporting that leads to the determination of that number. It's simply a calculation. And so we think that there's some of the information that's missing that's contributing to a high rate when clearly we're not seeing that on the ground. You're not seeing that in El Paso, just as you recognized.
And Dr. Zerwas, you just mentioned it, that positivity rate, even though it spiked, that average hospitalization rate, it's gone down 5 weeks straight. We're now below 200 for the first time since June. So do you think we're moving in the right direction here?
Oh, I think we're moving in the right direction. I think the citizens of Texas have taken the message very seriously that for us to get through this until there's some more definitive type of treatment, whether that be vaccine or some other kind of a therapeutic, the best thing for us to do is to mask up, distance, wash your hands, and avoid those congregate settings. That's clearly the message the governor sent right before the 4th of July. People clearly took that seriously, and that's why I think we're seeing the decreases that we're seeing in new cases as well as in hospitalizations.
And I was going to talk to you about the hospitalizations. Is the capacity improving because of this decrease in the number of cases?
Absolutely it is. What we're seeing right now is about 17% of all patients that are in the hospital right now are COVID-related patients. And so there's 83% that are in the hospital that are totally non-COVID related. And again, in El Paso, I think your number is even a little better than that. You're more around the 14 to 15% range as far as patients that are hospitalized with COVID. And your ICU hospitalization is also down based on the statewide number. You're more around 31%, whereas statewide ICU numbers for COVID patients are around 38%. But all these numbers are moving in the right direction. They're giving our healthcare workers a much needed breather, if you will. We've also moved manpower into various areas across the state, including El Paso, that have been there to step in and give some of the hardworking frontline healthcare workers a bit of a breather, and just long enough so that they can catch up and get back right into the mix of everything.
And I'm glad you talked about that, Dr. Zerwas, because it's about that personal protective equipment. Last week, we had several nurses here in El Paso protest the lack of access to PPE. Now, they say they have to use the same N95 respirators for hours or even days in some cases, and local hospitals say they have enough. So walk us through this process Texas is going through to acquire and distribute this PPE.
PPE supply chains, they're somewhat complex, but the hospitals all have their basic suppliers for various types of PPE. And so the N95s are one of those things. And in fact, the N95s can be one of the particular pieces that we tend to reuse, or not in a way that jeopardizes the health of anybody, but you can actually treat these masks, and they're still good for several uses beyond that. And that's something that we did actually when we did have a shortage back in the March and April timeframe, where we did need to really find ways to extend all of our PPE. But the N95 mask can very reasonably be reused after they've been treated and sterilized again and so forth. But the supply chains are really pretty strong is what we're seeing. If there is ever a situation where hospitals are running short of various supplies, certainly they can reach out to the state, and the state may have some stockpile that they might be able to deliver.
And I do want to question you, Dr. Zerwas. Does one person in particular decide then who gets that PPE? If you do have anything extra, you have the cities, the school districts, the hospitals. They're all trying to get it. Is that a group decision that you make at the state level?
Well, they have a formal process for, requesting things like this that's called State of Texas Assistance Request. STAR is the abbreviation for it. And that goes up through various channels in order to make that request. And then there's various supply channels in order to get those materials to the various hospitals. One of the things that we're doing a lot of right now, because schools are about to reopen, is that we are sending a substantial amount of PPE in the form of masks and face shields to the various school districts out there. And so, but basically, if a hospital finds themselves short of a particular type of PPE, they'll send that request to the Department of State Health Services. They'll take that request, process it, and hopefully in a very timely way get whatever needs are out there back to the hospitals.
And before we let you go, Dr. Zerwas, what can you tell parents, teachers directly? You brought it up. They're concerned about these schools reopening to in-person instruction. Are their lives being put in danger?
Well, I think I think it can be done quite safely, but that decision needs to be made at the local school district level. The Texas Education Agency and others have put out guidelines and recommendations for practices that should limit the spread and protect everybody. But ultimately, the school district, that elected leadership, the superintendents need to make those decisions in consultation with their teachers, administrative staff, and the parents. That's where the right decision is going to be made.
Excellent. All right, Dr. Zerwas, thank you so much for taking time and joining us today.